Good morning, Priti Patnaik, and thank you for joining us here at ILBO Live. Priti Patnaik is an independent journalist based in Geneva. She reports mainly about global health, and she has a blog on this, Geneva Health Files. Today we will discuss about India's dramatic health crisis. Priti Patnaik is originally from India, so she has quite a grasp on this topic. And I would start asking you how things are going in India regarding this COVID resurgence. What are the main criticalities there at the moment?
Thanks so much for this opportunity to speak with you. As I mentioned, I think my reading of the situation in India is definitely from the perspective of looking at it from a multilateral perspective of how it is being seen in international Geneva, let's say. So India is one of the more than 200 countries that have been affected by the COVID-19 crisis, but it is particular due to a number of reasons. One, the sheer challenges of a huge, population, and traditionally very uh, sort of little investment in public health infrastructure over the last couple of decades. A number of these factors have actually come to shape the way the pandemic has unraveled in India. And as you know, that did have first wave last year, and they had a very strict lockdown, as a result of which large parts of the migrant population were very badly affected because of the way the lockdown was implemented. And traditionally, we don't really have a social welfare protection system. So it also hit economically very hard on people, and millions were pushed under the poverty line, as it were. Um, so be that as it may, for a number of reasons, the first wave in hindsight appears to be less devastating than the second wave. But there are also concerns that even during the first wave, the numbers of infection and the deaths as a result of COVID-19 were undercounted. So that's what happened, last year, in the middle of last year. And then for many reasons, which is hard to fully understand, the number of infections went down, and a range of factors were attributed to it. From uh, natural immunity, natural kind of responses among that population to the disease, um, to higher tolerance levels and all kinds of factors. But now, as we see that the variant which is now the most prevalent is the B1617, which WHO has just this week actually classified as a variant of concern. Initially, it was only classified as a variant of interest. So this variant was actually detected, as per WHO, in October 2020. Uh, so between October 2020 and March 2021, um, I think that there was not sufficient policy response in terms of really ensuring that they are looking at these mutations closely. There were lots of reports that there was not sufficient um, political will and backing to share and collect epidemiological data on how the disease is progressing. And there were reports that the COVID-19 task force did not meet for a few months in between, which is unimaginable. And so Indian scientists and researchers are now calling for more transparency. Um, so come March 2021, there was a huge explosion of cases, and that met with the fact that there was essentially very little preparation, even in terms of ensuring that there was sufficient infrastructure to have medical oxygen, even in big cities like India. So what we are seeing is it's a pretty critical situation. The health system, the health facilities have collapsed even in big cities like Delhi, and the ICUs are full and critical. People who need services outside of COVID-19 have also been affected from what we read. So I think it's a test case of what happens if a country lets its guard down. And over and above that, you had a lot of other behavior in the population for not exercising measures of physical distancing, and then we also had elections and political rallies and so on. So it's a whole cocktail of factors that have actually resulted in a situation which is basically out of control at this point.
So the situation is out of control. During the first week of May, India almost reached 400,000 new infections a day, and countries around the world started sending their help to India. I would like to ask you, how are the Western countries in particular helping India in this phase?
From what we understand, many countries have sort of stepped up to show solidarity with India in this critical moment. With when the Indian people are struggling with the burden of the disease. Apart from sending oxygen concentrators and equipment and PPEs, we also know that, for instance, the Biden administration had also announced that the supply chains of certain raw materials that the US controls, those issues will also be addressed in order to ensure that vaccines that are being produced in India will not be affected. They have said that they will sort of consider easing some of those restrictions, and I'm not sure at this point whether that has already happened. And we also know that even neighboring countries, including, for instance, Pakistan, has stepped up with help, and I also read that Bangladesh, for instance, has sent remdesivir, because Bangladesh produces remdesivir, although the effectiveness of the drug is not entirely known to be effective as per WHO in addressing COVID-19. But so a number of countries have actually stepped up, and some commentators have said that this is a moment in time where it is comparable to the way the world stepped up to help Ethiopia, during the famine. And it's a very interesting sort of. No one, I guess, would have predicted that 3 months ago India was seen as a vaccine powerhouse, and now it's struggling to meet vaccine production for its own people. So it's definitely a very humbling moment for the government and for the people, and I think it has also shown that the world does care for India. But I will also hasten to add that uh, the best way of actually making countries like India self-reliant, uh, over and above humanitarian assistance, is basically steps like uh, waiver on intellectual property protection, that enables manufacturers in countries like India to make their own vaccines, and that is something that should also be addressed internally in India in terms of diversifying the base of manufacturers who can make vaccines and other medical products needed for COVID-19.
And we'll talk about this topic of India producing vaccines in a minute. But first, I would like to ask you something about a sort of a geopolitical questions. The Financial Times recently revealed that India and the European Union are discussing a sort of an alternative Belt and Road initiative to contrast somehow the Chinese dominance in the Indo-Pacific region. So I wonder if there is a sort of a diplomatic value in the aid that is coming from Western countries to India. What do you think about this?
Yeah, absolutely. I think COVID-19, as I've said, has had an immense disruptive effect across the world and across economies on many different sectors in the economy. But it has also totally turned upside down almost diplomacy as we understand it. Not just global health diplomacy, but so we know that vaccines have become a currency. We have spoken about vaccine diplomacy. We have heard about vaccine nationalism. I read earlier this week that the EU also sees vaccine as a security policy. The WTO has said that vaccine policy is economic policy. So you have so many different kinds of forces coming together to actually shape what aid means in the context of COVID-19. There is no doubt that the rush for humanitarian assistance for India is certainly a part of it is definitely genuine, but of course it definitely has implications for diplomacy. Last week, EU and India, for instance, restarted negotiations for a trade agreement that was stalled since 2013, and you also know that India got into a sort of a partnership called as the Quad partnership with US and other partners in the Pacific. The role of India in that partnership is less clear, but I think it is an extremely fluid situation where countries are moving in. Like, it seems as if that decisions on how to engage on a geopolitical level, it seems as if it's changing every few weeks, right? A few weeks ago we did not have the India crisis, so that really changes lots of different things. So I would definitely look at these engagements with the critical lens of what this means for diplomacy, especially because with the Biden administration coming in, I think it'll definitely sort of redefine the US-India relationship, and in that light, there's no doubt that the way the EU will also approach India will change. But this is all happening, simultaneously, and then you also have the EU being in opposition to India and South Africa's proposal on the TRIPS waiver. The reason we cannot separate these issues is because the EU is staunchly, as we speak, as of today, the EU still continues to oppose that proposal. But that holds the key to some extent on how this pandemic will be addressed. And that has implications on diplomacy as well. So I think that it's to put it simply, it's an extremely complex scene that is playing out, and you cannot separate one from another. And the only thing I will add is that before the India crisis hit, India was actually holding the flag on vaccine diplomacy by giving away vaccine doses, which is now, questions are being raised that why did you go ahead and donate all these doses when you should have vaccinated your own population first, and so on. So China, Russia, India, they definitely moved very swiftly in the second half of 2020, and we also read that the EU is sort of playing catch up now in terms of vaccine diplomacy. And the only thing I'll add is that the WHO has called out initiatives like the vaccine diplomacy just earlier this week, saying that this is not cooperation, this is just geopolitical maneuvering. So I think all countries are indulging in this, or let's say most countries are indulging in this. And because there's this acute situation of scarcity, there is appetite for this diplomacy because people need vaccine doses, not just India, but other lower and middle income countries.
So given that we know that India now needs vaccine doses, we know that India is one of the biggest COVID vaccine producers in the world and is playing a crucial role in the COVAX initiative, which is helping providing low and middle income countries with COVID vaccines. We know also that India now needs more than ever vaccine doses within the national borders. So how is this health crisis in India going to affect low and middle income countries' vaccine campaigns?
Yeah, so I think the situation has changed dramatically. The way you framed your question was true till a few weeks ago, but now the situation has changed dramatically. We know that China, for instance, is now moving quickly to supply as many vaccines as possible. And in the short to medium term, India will not be able to honor its obligations. So there are two things that reveal the current situation. One is that the world's reliance on one country and literally one manufacturer to service the needs of more than 90 low and middle income countries in the COVAX facility. So that was a bet that was not hedged and has horribly gone wrong. The COVAX facility has had a number of shortcomings, one of which is the fact that they did not anticipate bilateral deals and the fact that they relied on one country and one manufacturer. And we know that Gavi and India has had a special sort of relationship and a partnership over the last many years. So undoubtedly, not only is this situation precarious for India, for every other developing country dependent on India. I think the number of doses, from what I understand, there were about 50 million doses given for countries eligible, the low and middle income countries eligible under the COVAX facility. This is much less than what was initially expected. And as far as I can tell, there is no visibility yet on when the doses will, start flowing from India again. They say that it could be in June or July. It's not clear yet. So of course it's a very very precarious situation for those countries who depended solely on the COVAX facility. But we also know that many countries had actually started making their own preparations of not having bilateral conversations and deals with manufacturers so that they don't only depend on the COVAX facility, but a significant number of them have actually been left without access or without access to as many doses as they had hoped. So the situation is dire for the COVAX facility, and it's precarious.
You already mentioned, of course, Biden's announcement, Biden's decision to support vaccine patents lifting. And I would like to ask you what do you think about this? Because we know that India, along with South Africa, submitted a document to the World Trade Organization last October, I think, asking for a suspension of the intellectual property protections on vaccines. Now, of course, Biden supported that proposal. The European Union, it is not entirely clear what has decided, but it is maybe not on the same position as the US. In general, is it good news to hear this decision from Joe Biden for India and low and middle income countries, or is it more complicated than that?
I think it's definitely a great first step that has been welcomed around the world. And as part of reporting for Geneva Health Files, we have sort of tracked these discussions over the last 6 or 7 months. And at the face of it, the decision of the Biden administration to actually support text-based discussions on a blank on a blanket waiver proposal on intellectual property protection is being seen as a watershed moment in the more than 25 years of the TRIPS agreement under WTO. So that is something we must take into cognizance. Having said that, what this will actually mean going forward remains to be seen. The number of reasons. One is the fact that in the statement by the USTR, they have said that potentially they would like to support the suspension of intellectual property protections only for vaccines. But the original proposal actually talks about vaccines, diagnostics, and therapeutics. So that's obviously going to be a key part of the negotiation going forward. And secondly, these could be really long, drawn out discussions and negotiations. This is definitely the beginning of a long phase of negotiations. The role of how the EU and others will respond to this will become obvious in the coming weeks and months. But we already have seen a shift in position from some of the other countries who were hitherto opposed to it, including Norway, New Zealand, and I think even the UK has said that they would want to be constructively engaging in these negotiations. So all of these are positive signals, but whether it will mean the proponents of the proposal will get what they demanded for, that remains to be seen. It's definitely not going to be easy. And the other thing which many have expressed concerns is that apart from the waiver of intellectual property protection for COVID-19 medical products, not just vaccines, we will also necessarily need technology transfer in addition to the waiver, so that manufacturers in the developing world become reliant to make their own medical products to meet the needs. I think again, this is being seen, somewhat like a earthquake in trade diplomacy circles. There's no doubt about that, but one has to be cautious about what this will mean in a few months down the line. How long will they actually take to agree to something like this, and when is it that countries like India will start to see the benefit of a potential waiver? When is it that they can start making vaccines without the threat of being sued and so on and so forth? And remember, like I said, that internally, India has to resolve itself on how to broad base manufacturers to make vaccines domestically as well. So yeah, it operates on two different levels.
Priti, thank you very much for this very stimulating conversation. You draw a super interesting picture, not only of India's situation, but of the global situation. And wish you the best with your Geneva health files.
Thank you so much.
Thank you.